County Live is brought to you in part by the Madison County Health Department, protecting, promoting, and improving the health of our community. The all-new Chevy Silverado, now available at Jack Burford Chevrolet and always available at jackburford.com. And by Twine Market and Design on 3rd Street in Richmond. And by kymedia.net, digital media services from top-of-the-line video production to live streaming services. Hey everybody, welcome back to Madison County Live. Colleen and I have a special guest remotely in studio, Madison County Health Department's Kelley McBride. Welcome, Kelley.
Hey, how are you all? Hope you're staying safe and healthy.
We're doing our best.
We sure are, Kelley.
Good deal.
It's always a pleasure to see you.
Well, you all make me feel so nice and special every time I come on. So I appreciate everything that you're doing for the county to share good information and the good stories out there.
Thank you. Thank you. So what do you have coming up this week, Kelley, that you want to talk about that's going on at the Madison County Health Departments?
Right. Well, there has been a lot of testing news going around, and Madison County does not have drive-through testing, but there were a couple of folks on a conference call this past week, and they thought it would be worthwhile if we talked a little bit as public education about the different types of testing that there are. So I volunteered to do that. Okay. And I'm not a doctor. I don't even play one on TV. I'm not a nurse. So, but I will share what I have learned about testing.
Okay.
And if you want to learn any more, you can always go to the cdc.gov website, and they explain things very, very well. So what I've learned is there are two categories of testing. There are viral tests and there are antibody tests. So the viral tests are the ones that are taking place in Madison County at different locations. You can call your primary care physician, or you can call one of the local, you can call our clinic to find out some of those places that are offering testing. Okay. So the viral tests, and there's two of those. There's an antigen test and a PCR test. Oh. And I'm not even going to try to pronounce all the PCR thing. We're just going to go with PCR. So the antigen test detects viral proteins.
Okay.
And that's to discover an active infection. So it's done with a swab, similar to a strep test, but I've been told it's not like a strep test. It's uncomfortable. About 30 seconds. I had heard that too, and some things that I've seen on videos. It does look very uncomfortable, but it detects those viral proteins, and the results are known rather quickly. But you may need further confirmation from a follow-up PCR test. So the PCR test looks for specific genetic information of the virus.
Oh, okay.
And it's a more specific test, as you can imagine, going for that genetic information. Okay. So the results of that are known in 24 to 48 hours. And so that will let you know if you do have a positive or negative result for COVID-19.
Okay.
So the other... I'm sorry, I'm just rolling here.
Excellent.
The other category of testing are the antibody tests. Sure. And so that's been in the news a little bit lately too, because the FDA doesn't support all of these antibody tests. So the antibody tests detect if you have had a previous infection of the virus, and they should not be used to diagnose if someone has a current is currently sick with COVID-19.
Okay.
So there are a couple good things we can learn from the antibody tests. Mm-hmm. They end up giving us a better picture of the
Right.
infection by providing more accurate data of how many people have had the virus.
Right.
So, as you can imagine, there are some drawbacks. So some of the drawbacks to the antibody testing is it can produce false positives and false negatives.
Okay.
It's possible you could still get sick if you've been exposed to the virus recently, and evidently those antibodies don't show up for maybe 1 to 3 weeks after the infection, so you could still spread the virus.
Oh.
So we don't want anybody thinking that, oh, well, I don't have it and I'm not as careful, or I'm not self-quarantining, so you could accidentally spread the virus.
Okay.
And it takes some people longer to develop antibodies, and some people may not develop them at all.
Right.
And as I mentioned, the FDA doesn't support all the antibody tests. There were some recent reports that that just a minority of the currently available tests could detect the antibodies in those people who had recovered from COVID-19.
Okay.
So a lot to think about there.
Yes. So testing wise, where can people go? Where's the clearinghouse for the information for this?
Right. We have a list that was provided and vetted by the health department. So we will be listing those locations, and you will always want to call ahead before you go to get a test.
Okay.
Something else I needed to mention is that it's unclear if these antibodies can provide immunity against getting infected again.
Right.
So, yeah, we don't know if the antibodies make you immune to the virus.
Sure.
And that, but just wanted to point that out to you as well.
Okay. And I guess all this information will be on your website, right?
Right, and we share it on Facebook and Twitter and our website as well.
Right.
So just remember to continue to do that social distancing, and we've had information about wearing masks. Mm-hmm. So we're going to come up with some more maybe clear-cut ideas of what our days will look like going forward with as things start to open up again. Mm-hmm. And but wearing a cloth face covering will be part of that.
Right.
So we'll have more information to come on that. But that doesn't take the place of social distancing.
Exactly. And mask. Yeah. And wash your hands.
Wash your hands.
Yes. Wash your hands. And I know masks are pretty available out there now, as far as I know. I've not been able not to be able to find one. So if someone needs a mask, where should they go?
Well, it's interesting that you asked that. The Madison County Health Department and the Emergency Management Agency and a group in Berea, Team Berea, they're a community response group, and to respond to the needs of their community in COVID-19. So we kind of combined efforts, and we have created a resource list that is available at EMA, the health department, and both city governments. If you call any of those numbers, they can give you some information. And what we're doing is we are encouraging people to make their own masks as much as they possibly can.
Right.
And we have a list of some groups that are making masks. Okay. So if you need that resource, you can be put in touch with them. Okay. And I know that the Emergency Management Agency has shared on their Facebook page some of the groups that have Facebook pages as well. So
cool.
We can put you in touch with those resources.
Okay. And you'll be using those, sharing those on Facebook too.
Right. It's mostly, if we're ready to take calls, but we can share some of those things. Not all of the groups have said, yeah, it's okay to put me on Facebook.
Sure.
But we have phone numbers, and we do have Facebook page links to those who are comfortable with us putting that out there.
All right.
Well, Kelley,
I wanted
as
to-
always, you bring us so much information. Are we forgetting anything? Is there anything else we need to share?
Yes, ma'am. I just wanted to mention that our clinics are still here to serve folks during the COVID-19 pandemic. We need folks to call ahead.
Right.
The Richmond number 623-7312 and Berea 986-1192. The Berea location is operational on Tuesdays and Thursdays, 8 to 4:30. And the Richmond location is still operating at our same hours. Monday is a long day, Monday 8 to 6,
Okay.
and Tuesday, Wednesday, and Thursday 8 to 4:30. And on Friday, it's from 8 a.m. until noon. So we need folks to call ahead, and we have curbside service.
Right.
And as people are getting used to that, both locations will provide curbside service. But if it is determined that you need to come inside, we'll ask you to ring a doorbell and to let somebody know that you're there and to come in. And we will have hand sanitizer and a face covering waiting for you so that you can enter the lobby.
Excellent.
Fantastic. Well, Kelley, as always, we appreciate this information so very much. The Madison County Health Department is doing a wonderful job.
Yeah.
And we appreciate everyone that's involved to make this a team effort, for sure.
Well, thank you for mentioning that. And I would be remiss if I didn't mention that this week has been Nurses Week.
Yep.
So we have a great staff. Everyone who works there and works with me, I think is a great asset to this community. But especially this time, during this challenging time of COVID-19, they are really our heroes. So I want to give a big shout out to all of our nurses and thank them so much for their service.
Absolutely.
All right. Well, Kelley, once again, so very much for joining us. Thank you to your entire team, and special thanks to the Madison County Health Department.
Thank you.
All right, folks, you've been watching Madison County Live. Thanks for joining us.
Watch Madison County Live premieres on Facebook and YouTube every Saturday evening at 8 o'clock with replays at 8 a.m. and 9 p.m. on Sundays on Facebook. And of course, always throughout the week on the Madison County Live Facebook page.